Okay, tell me exactly what's happened.
The puppy and my son were playing, and I don't know if he's bit his private bit or he scratched it.
Okay. Do you mean his penis?
There's a big cut, yes.
Okay. And how old is he?
He's 2.
And when did this happen?
When did it happen, Scotty? Just now. Just now. Do we have to keep pressure on it?
Is there any serious bleeding?
Is it serious bleeding, Scotty?
Oh, it's blood away, mate.
Is it spurting or pouring?
No, there's a big white chunk taken out.
Did you say you thought a piece was taken out of it?
Yeah.
Okay. If you can find the amputated parts or skin, I want you to place them in a clean plastic bag. Do not place the part on ice or in water, as this may damage it, okay? Did you understand what I said?
He's got to put ice in cold water.
No, do not place it in ice or in water, as this may damage it. Okay, so just listen carefully. Okay, have you located the amputated part?
No, it's not amputated, it's been bitten.
Okay, I want you to get a clean, dry cloth or towel and wrap it around the wound, okay? And be reassured that help is on the way. From now on, don't...
Towel okay?
Yes, that will be okay. If you get a thicker towel, that would help more. Is it?
What?
Have you got a bigger towel than that?
Put him down, hold him. You can't put him down, you gotta hold him. Shut up, you poxy dog. Oh, God. How far away though?
Just a couple of minutes. If he gets worse in any way before they arrive, then please call us back immediately on 000 for further instructions.
Yeah.
All right, thank you. Bye-bye. Ooh, that would be sore. Puppy sounded like it was going to a new home, because Mum was very angry.
Every day, Queensland Ambulance receives more than 2,800 calls for help.
The 2 vehicles head-on, we've got 3 children involved. He fell over, but all his skin's peeled off his arm.
No. He's going blue. He's going blue. What do I do?
With unprecedented access,
Wasn't responding at all.
we follow emergencies from the heart of the operations centre
Single vehicle RTC, male patient passed out.
to the paramedics on the front line,
How did it happen? Tried to skid around the corner.
fighting to save lives.
Do you have any pain in your legs?
In Brisbane, it's the start of the day shift for the Queensland Ambulance Service.
Good morning. Logging on 11:23 out of Redden Bay.
Good 555 radio, test station will be through shortly.
Thank you, you too.
On average, call takers at the Brisbane Operations Centre expect to answer 50 emergency calls an hour. But it's a slow start to the day.
It depends if the Ashes is on in Adelaide at that time. So I'm going to go to a day of the cricket.
Adelaide Oval's beautiful. And Hague's Chocolate Factory.
Oh yeah, recommend.
Only small, but the chocolate's amazing.
I reckon it's going to be a hectic day. It's not so bad now.
Not yet.
Not yet. But I reckon it's going to be ramping up very shortly.
Oh, the sun is brighter than my future.
Across Queensland, 800 ambulance crews are ready to respond. Backed up by 50 critical care paramedics like Rachel.
Alpha 506047 on your channel.
Got a 25-year-old female patient conscious of breathing.
I've been a CCP now for nearly 3 years. I love it. I couldn't do any other job. No 2 days are the same. You never know what's going to happen. It's all unpredictable, but we need to be ready for everything.
Ambulance, what's the town or suburb of the emergency?
Hey, wake up.
Tell me exactly what happened.
He's had a heroin overdose. Hey, come on.
Is he awake?
He's in and out of consciousness. Come on, wake up. I'm trying to wake him.
I'm organising help for him now. Stay on the line and I'll tell you exactly what to do next.
The patient's critical condition prompts an immediate response. A paramedic team is dispatched, code 1, lights and sirens. CCP Rachel is 5 minutes behind them.
Triage Brisbane to Alpha 5060047. You're heading to a 27-year-old male, not conscious, not breathing. He's had a heroin overdose. Code 1, thanks.
Roger, thanks. I grew up on the north side of Brisbane. Went straight from school to uni to do paramedics degree. It was definitely a steep learning curve and forced me to grow up very quickly, especially for someone that really had a sheltered sort of upbringing. Just suddenly seeing that that's not actually the majority of the world. There's people out there that, abuse alcohol or drugs or homeless, a lot of mental health, stuff I'd never really seen or dealt with.
Every year in Australia, there are more than 1,500 drug-induced deaths. That's one every 6 hours.
Are you right by him now?
Yeah, I might be fine.
Look at him very closely and tell me exactly what you see and hear him doing.
He's got his eyes kind of rolled back into his head. He's got a bit of it's a bit blue. Yeah, I can't really see him breathing. Hey.
We're going to need to help him out. Listen carefully and I'll tell you how to do resuscitation, okay? So pinch his nose closed and completely cover his mouth with your mouth, then blow 2 regular breaths into the lungs about 1 second each, okay? The chest should rise with each breath. So do that now.
Heroin is something that I've seen a lot of in my career.
With narcotics, it causes respiratory depression, so it makes them stop breathing.
That oxygen deprivation will eventually lead to cardiac arrest if it's not fixed.
Place the heel of your hand on the breastbone in the centre of the chest, right between the nipples. Now put your other hand on top of that hand.
Yeah.
Now you're going to pump the chest hard and fast, at least twice per second and 5 centimetres deep, okay? Start counting out loud for me.
1, 2, 3, 4, 5, 6.
Okay, we need to go a little bit faster, okay? So 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. Keep doing it over and over, okay? Don't give up.
Yeah, each time I've done that, you can hear that?
What just happened?
He's kind of like gargling kind of.
Okay, that's important. We need to keep doing compressions then, okay? Don't stop what you're doing until the paramedics are right there and tell you, okay?
Yeah.
So 1, 2, 3.
We drive lights and sirens to these high-risk overdoses because there is a lot of risk. Driving to a job like that, trying to anticipate a clinical pathway for a patient. We need to work out timeframes. We need to work out what agents have been taken.
Just don't know where in the park we are, which is going to make things a bit challenging.
In terms of predicting outcomes, it's always very, very challenging.
We need to keep doing compressions then, okay? So keep going. So 1, 2, 3, 4. 1, 2, 3, 4. Keep going, okay?
2 units have been called to a man who stopped breathing after a heroin overdose. The first crew is moments from scene, with CCP Rachel minutes behind them. The patient's friend is administering CPR.
1, 2, 3, 4. Did you get...
Oh, no.
Are the paramedics there?
You made it just here.
Okay. I'll leave you with them. Take care. Oof.
Hey guys, I'm Rachel.
I'm Adam, this is Pat and Kate.
Hey
so
guys.
27-year-old gent here has had some heroin just before 3 o'clock today. Friend said has then come out quite drowsy and then just gradually declined.
The patient is not breathing on his own. The paramedics are keeping him alive through manual ventilation.
Are you his friend, are you? Was this more than normal?
It's like I say, 1 week user, kind of doesn't use it every day.
Okay.
Once a week, once a fortnight.
Okay. Does he use meth or anything like that?
No.
No, so only heroin.
But he doesn't use it anymore.
Hey, Kate, can we try and ventilate a little bit faster? Do you feel like you've got a good seal there? Yeah, good. Looks like you do on the waveform.
So my role as a critical care paramedic is clinical leadership of a scene, but also supporting and guiding our younger paramedics.
Can we just turn that around so Kate can see it?
But you're constantly balancing that against always being ready. This patient could deteriorate at any point in time.
So guys, I think we're pretty low-risk patient for receiving IM naloxone. You've seen naloxone before, kind of similar to an EpiPen of naloxone, and they have that at the chemist. It's a lifesaver.
Naloxone temporarily reverses the effects of heroin, bringing the patient back to consciousness and restoring their breathing to normal.
So Kate, I just want you to be aware that even though you should wake up fairly okay, just be mindful that it's quite normal for them to pull ECG leads off and sometimes be a little bit upset, okay? Just keep ventilating at that faster rate too, that's really good. All right, let's go the naloxone, hey? He should hopefully just wake up. If he doesn't, then obviously we get a bit more concerned that there could be something else going on, but I just want to hope look at those lines.
Oh, buddy, wake up.
Should be coming up soon. There you go. You're okay. You had some heroin, mate. You had too much. You overdosed. Yeah, you were at the ambulance. We had to breathe for you. Your mate here did some CPR on you. Yeah. Just don't lay back down. I don't want you to crack your head on the cement. Yeah, have a big cough. That's normal, mate. Do you remember taking it? Yeah. So from here, we'll probably just head typically the Mater or the Royal.
Yeah.
We'll let you know. We won't go anywhere without letting you know. If you want to come with us, you can.
Yeah, okay.
Okay. Can I explain to you why? We had to give you a drug that reversed your heroin, okay?
Stop breathing. Look out cold.
The thing is...
Not before, it's worse than before. It's good. Pump you up again.
Yeah. You
have to go.
You potentially will go unconscious again, is my concern, okay? Listen to your friend. He's got your best interests, eh? Can I help you up? Come over here. There we go.
Before I became a paramedic, I had no idea about the prevalence of drugs in our society. After 10 years in the job, I've seen just how common they are and how much of an impact they have on our community. But it's our job not to judge and to treat them as we would any other sick patient.
047, our patient's now GCS 15. He's responded well to treatment. Roger, at this stage we'll aim for the Royal. Thank you.
Hi. He's following up behind us. You guys been friends for long? Yeah. Brother, hey? He was a bit worried about you. You're lucky to be alive.
Overdoses have always been there. They've always been a part of our job. My goal is just in that acute moment to get them to the right place, try to get them the help that they need, and that we take the best care of them that we can in that moment. If I sat there and thought about why people did it, I wouldn't be able to do my job. Everyone has a story, don't they?
Just at the hospital, okay? The friend that was with him that recognised when he started to become unconscious, he's the one that saved his life by calling, by starting breathing for him and compressions and lighting up the system so that we can get there and give the medication to reverse him and wake him up. If he didn't get any ventilation or the medication, he would die.
Ambulance, what's the town or suburb of the emergency?
We're in Narimba. We all just heard a thump, came outside and a crane's just gone through 2 houses and we can hear a lady scream.
Sorry, did you say a crane?
Yes, a crane. There's a house being built. So 2 houses got knocked out. It was really loud. The whole house shook. And we're like, what the heck was that?
Yeah.
I thought it was a car accident, but it was a crane.
Do you know how many people are hurt?
I have no idea. I put on my partner. He's over there.
You there? I just want to confirm a crane has fallen through 2 houses, is that correct?
A massive crane.
Okay, does this...
2 houses.
Okay.
Is anyone trapped at the moment?
No, I made sure everyone's out.
All right. Are there any obvious injuries?
Yeah, one of the blokes is a little bit banged up.
All right.
He's the crane driver.
Yeah.
Apart from that.
Were they actually in a house, though, when the crane fell?
Yes, they were. They were all in the house.
Yeah.
The whole house shook, eh? Yeah. It's a miracle no one's dead.
Well, Scott, you've done really well, mate. I'm going to leave you with the paramedics, okay?
Okay, cool.
All right, take care. Bye-bye.
No worries.
Holy. I've never had that before. That's unreal. Did you hear it? You'll never believe it. A crane has toppled onto 2 houses.
A crane?
I was like, sorry? What has happened? There were occupants in both houses and they were all like unscathed. That's big. Crane accident. Oh, well, it did come up. What? Oh. I was sure there was going to be fatalities, hey? Crazy. Can I just go back to chest pains and abdo pains? Give me a stubbed toe for all I care. No more cranes. Ambulance, what's the town or suburb of the emergency?
Tomorrow's grand final day. Are you ready? Do you reckon QAS would approve of me watching it on my work iPad?
I don't think so.
It's 4 p.m. in Brisbane and paramedics Jeff and Tamara are 2 hours into their shift.
That dog, that Dashin, looked exactly like, what's the dragon's name in Neverending Story?
I don't think I've seen the Neverending Story.
Can you Google it for me?
The dog, the
Dragon
in Neverending Story.
Yeah.
Falcor.
Falcor, that's it.
Is Falcor a dog or a dragon?
He's like a dog dragon. Yeah. He's like a long-haired dragon that looks like a dog. It's just a big flying Dashin.
Aww. That sounds very cute.
Ambulance, what's the town or suburb of the emergency?
Redland Bay. There's an older gentleman just across the road from our shop that's riding his mobility scooter and has flipped the scooter and he's on the ground.
Okay. How old is he?
Oh, late 80s.
Late 80s. Is he awake?
Yeah. But he's a bit disorientated. He can't really talk.
Yeah. They'll be there as soon as they can. If he gets worse in any way, call us back immediately on 000 for further instructions, okay?
Okay. Yep,
Okay.
no worries. Thank you very much.
You're welcome.
In car 161, Jeff and Tamara are dispatched to the job. They're 10 minutes from scene with a single responder just ahead of them.
85-year-old male. Consciously breathing. He's come up with mobility scooter. Mobility scooter is currently on his leg.
Mobility scooters are heavy.
Yeah.
85-year-old bones are not.
It's always concerning going to accidents involving elderly patients. Their bone density isn't as strong as, say, someone in their 20s or 30s, so even small impacts can cause significant fractures.
He's still down. Please don't walk there.
Let's have a look first.
Yeah, sounds good. On scene.
Hello. How long has he been on the ground for? 20 minutes. Was
Did you hit your head?
Was he trapped underneath it at any time?
That's basically how he fell.
Yeah. What's his name? Ray, is it? Perfect. Was he conscious the whole time?
Yes.
Perfect.
How heavy is
it?
this thing?
It's quite heavy.
We're going to try and get this out from out behind you, Ray, so that we can get you up.
Did you want me in there, Jeff?
I'm all right.
You sure?
Yep. You in pain anywhere? No?
With no apparent leg fractures, it's safe to move the patient.
Ready? Push through your feet.
1, 2.
Is he on? I've still got him. Hold up. Don't fall forward. How did it happen? Did you just drive into the bush?
I tried to skid around the corner.
Tried to skid around the corner. Tell me if there's any pain when I do this. No? That's all right? All right, we're going to get you on the bed, all right? Can you walk at all?
I'm at Parkinson's.
Oh, okay.
In your own time. That's it.
You got him, Tim?
Yeah, I'm over here. I'm going to take this out.
The patient is 92 and lives in a nursing home 3 minutes away.
A little bit more, perfect. There you go.
To be a good paramedic, I think you need to have humility. I think you need to be caring. And if you can't talk to people, you can't do the job. Most of the job is communicating with people, and if you can't sit down and have a conversation with someone you've just met, it's going to be a difficult ride.
All right, we're going to have a clean-up of your wounds, all right? Now that you're on the bed, are you sore anywhere?
No.
No chest pain, headache, dizziness, nausea, nothing like that?
Nothing like that.
Perfect.
I'm going to take me to hospital.
I think we should, just to have someone look over you and make sure everything's okay. What do you reckon?
Unnecessary.
I mean, we can't make you go, but we can give you advice to go. So how about we clean up your wounds, we'll talk, and we'll see how we go, okay?
There's nurses there.
Working with elderly patients, it makes me think about my grandparents. I guess I'm still lucky that I have grandparents who are, completely sound of mind, well into their 80s and still live by themselves in their own home.
The worst possible outcome from this is that you go downhill and you get permanent injury or potentially death from an injury that we can't assess for properly, okay? And I know that probably doesn't scare you, but we still have to tell you, okay?
News of Ray's fall has reached his care home.
Ray,
Hello,
what happened?
I fell.
So at the moment, he just went to the hospital. He's refused. Yeah, that one will need to be changed.
Ray,
Might just pop a band.
I think due to the amount of wounds on you, you should go, mate, and get them all cleaned up, dressed, and come home. Go to the hospital and get checked. For me, please.
I don't know with me.
No, I know you would, but can you go and get checked, please? This is 2 falls in 24 hours now. Go get checked. Will you go get checked?
No.
What about if I give you a kiss on the cheek? Will you go get checked?
Just pull that up. Just hold that.
I'll call your daughter. Hang on.
I think maintaining a level of patience was important. Time frame's not an issue, and I think that's how you manage your patients. You just got to remember that as long as I do my best for this person, then whether or not we sit here and talk for a short while or a long while doesn't matter.
You allergic to anything? Going to hospital?
Yeah.
Yeah.
Hey, someone wants to talk to you.
Who's that coming up?
Hi, Dad.
It's your daughter.
Hello, Leanne.
Dad, you've had an accident. That's not good, is it? I think they're concerned about the extent of the skin tears, Dad. This isn't just a normal fall at home. This is a rolling the scooter.
Well, the scooter's all right, darling.
More concerned about you than the scooter. My thinking is
Emily and the ambulance officers think that it's worthwhile this time, then maybe.
You brought one.
Well, I'm almost convinced, but I don't think it's necessary.
Ray,
we don't
I
mind.
don't want to worry about you, please. I don't want to be panicking about your health and well-being. So will you please go and get checked? Because I do care about you and I want what's best for you. Please just
Well, how
go.
can I refuse?
There you go. We'll go then. Hey?
Yeah, I think that's a fair decision, Dad. I think that's being considerate and fair for you and Emily as well.
All right, perfect. If anything changes, I'll let you know. But otherwise, we'll be in Marta, South Brisbane.
Thank you very much.
All right, thank you.
Thank you. Great. Bye-bye.
See you later, Dad.
I'll talk to you later, Dad.
Okay.
Okay.
Thanks, guys.
Thank you very much. Sorry, mate. It's for the best, all right? Think of it as an outing for a few hours. We'll get you home in no time. Couple of belts.
You don't want to fall in.
Again.
No.
We all worry about our family getting older, but what you do about that, I guess, is what really matters. You just have to reassure them that it's going to be okay and you're going to take care of them one way or the other and support them through their life. Your date of birth?
9th of the 6th.
9th of the 6th. What year?
Every year.
I really admire Jeff as a paramedic. Jeff treats elderly people as his equal and he creates a great relationship and rapport there in order to kind of make them feel comfortable, make them feel safe. Jeff just seems to bring out smiles with our elderly patients and brighten their day in any way that he can.
Your health is priority, I think your family say the same thing. That's all. I mean, I just treat you like you're one of my own, all right? So that's why I want you to get checked out.
You seem like a wife.
A wife?
Have you seen the horses in your station? No. Nay, I have not. We'll stop horsing around.
Today, Eliza and CJ are working together for the first time.
So you normally work with Lucy? Yeah, I do. How come she's not here this week? And she's actually heading down to Tasmania to go to a friend's wedding. Ooh, nice. Yeah. Left you at work. You guys are divorced for the weekend.
Working as a paramedic is all about teamwork. Whether you've worked with someone for the first time or you're working with someone you've known for many, many years, it's all about combining your knowledge and your expertise to be able to deliver the best care for your patients. It can be challenging, it can get a bit bumpy, but it's a crucial part of our job.
Ambulance, tell me exactly what's happened.
Yeah, I heard a big bang. I've come outside. There's a woman and a man come off a bike. The guy's in a pretty bad way, and the woman who came off is conscious, holding her arms.
501-131.
Yes, 501-131, thank you guys. Code 1, please. 2 patients involved, fell off a motorbike, pre-dislocation to the elbow. 2 patients, code 1.
131, affirmative. Unsure if they were wearing helmets, only can see one helmet now. Okay, so that adds a whole another element to it. It does. You have no walls, you have no windows, you have no crumple zone.
Motorcycle accidents make me anxious because I feel like there's so many things that can go wrong that we can't control. Someone not wearing a helmet on a motorbike, your body is what's taking the impact of the accident.
On such a public road, that makes me nervous. Oh, man.
So these patients are more likely to have major trauma. You need to prepare yourself for the worst.
On Australian roads, nearly a third of all serious injuries involve motorcyclists. they are 30 times more likely to die in a road accident than passengers in a car.
The first traffic accident I ever went to was horrific. The passenger of the vehicle was someone that I went to uni with, and he unfortunately passed away at the scene.
Divide and conquer?
Divide and conquer. We got this.
You don't expect to rock up to an accident like that and see someone that you know. It's quite heartbreaking. It wasn't until I walked away and I got back to station that I think it really hit me. So that was a couple years ago now, and it's something that still sits with me.
That's a uniform I recognise.
A nurse on her way home from work has stopped at the scene and assessed the patient.
I just rocked up. He's removed his own helmet. Can't see any, obvious large bleeding.
Yeah.
He has 15, opening eyes spontaneously, answering questions, complaining of some rib pain bilaterally. Haven't been able to get him to move his legs, so I'm unsure whether that's pain or...
Okay. Where's your pain? In where? Your side. In your ribs? Yeah. Do you have any pain in your legs? A little bit. Okay.
The patient's symptoms indicate major trauma to his chest and back, with a high risk of spinal damage.
Did you hit your head? No. You don't know? Okay. What's going to happen, just so I can have a better look at you, is we're going to roll you onto your back and we're going to support you in that movement, okay? Eliza, can I just borrow your hands for 2 seconds?
Absolutely.
We're just going to see spine roll.
Is that pain there?
No.
No. On 3. 1,
Yep.
2, 3.
Sorry, I just need to be able to see you more. Aaron, can you open your eyes nice and wide for me? Big eyes, big eyes.
As a new paramedic, I was nervous and I was very self-critical, and I thought everyone else was very critical of me.
Both reactive. Perfect. Oh, yeah, okay, sorry. Okay, I'm going to take that he's got some abdominal involvement.
When you're in the community or you're in the middle of the road, there's so many extra eyes on you, and that's a lot of extra pressure to put on you other than the pressure that you already put on yourself.
Are you okay? Yeah, you've got a bit of a bung elbow, hey. Alrighty. I'm just going to feel your pulse there. Okay. Yeah, all right. Were you wearing a helmet?
No.
Did you hit your head at all? No. No. Okay, you remember the whole thing?
Yeah, I blacked out.
We recommend a trip up to hospital, okay? It's coming back in 2 seconds, lovely. Yeah, alrighty. 139, could you get another crew attached to this job, please? We've got 2 patients. One was suspected C-spine injuries. The other with a dislocated elbow, and she was not wearing a helmet during the accident. Can we get them code 1, and can we also get a CCP attached as well, thanks?
Roger, have them to me code 1.
Thank you. You're all right.
You have to keep your head nice and still. Bring the whistle to your mouth.
Look, you've been in an accident today. It's quite likely you've injured yourself quite badly. We've got another crew coming so they can help you. So I recommend you just stay here, okay?
No, it's very sore.
Keep your head nice and still. Bring the whistle to your mouth. Damn.
Oh, come on.
I know it really hurts.
Paramedics CJ and Eliza are attending a motorbike crash in Wynnum, east of Brisbane. The driver has suspected spinal injuries and his passenger has dislocated her elbow.
Big breaths. Our backup is here. Hey guys. So this was the driver of a motorbike wearing a helmet, unknown speed, come around the corner and they've slid with query head strike, unable to really tell us the events. Was witnessed, hasn't really moved since. He's got some C4, C5 pain on palpation, quite tender on the right-hand side of his abdomen up into his ribs. If you guys could work on some pain management because he hasn't been good with the whistle.
Please go on the other side. It hurts.
At the minute, we're a little worried about your neck. Just try not to shake and nod your head.
In a motorcycle accident, these patients are more likely to have spinal injuries.
We are about to get you up off the ground. There's going to be a bit of a hardboard that comes up underneath you.
It definitely adds a degree of difficulty because they're more time critical and they need to get to hospital, but you need to move them slower.
You ready? Everyone on 3. 1, 2, 3. Hardboard. Perfect. 3.
You have to make sure that they're okay and do the best that you can, so it's a huge pressure.
2, 3. Pardon? She's trying to run her. Now you see the other side. She gone?
She's just run off.
Okay.
Do I have to go in ambulance? Like if I say I don't want to. I'm okay.
Like you got a dislocated elbow. I don't know. I would say that's okay.
That'll be all right.
It'll be all right. How's it going to get undislocated?
Is it okay if I see your arm? Is that okay?
Yeah.
Just have a quick look.
Yeah.
Yeah. See, that's pretty bad.
You've been in a motorbike accident, you've bumped your head. So obviously these are all really concerning things. If untreated, could lead to severe injury, even death. If we tell you you need to go to hospital, it's not something we take lightly. It's something like it means we're worried about you. With a dislocated elbow, if it doesn't get fixed, it can lead to permanent nerve damage, permanent bone damage. All could be fixed with just a quick trip up to hospital. You can pop back into place and you could be on your way home tonight. Do you still want to go against medical advice?
Can I go now?
Yeah. Teammate, get that elbow looked at. Can't help everyone, unfortunately, as much as we want to.
There we go. My main concern is just ongoing pain management. Obviously, it's quite bumpy when we're moving around, and keeping an eye on that possible pneumothorax, making sure it doesn't develop further. Are you in line with that? Cool.
Cool, you ready to go?
Yeah.
Working with CJ for the first time, I am super impressed. She just has this quiet confidence about her that really puts her co-workers and her patients at ease.
Since I started working as a paramedic, I would say that I have a lot more confidence.
I got hands.
We can put it down now, yep. Yeah, there you go.
I like that I get to be the person that can be there to help, and you know that you've made an impact on their life. Because at the end of the day, that's all that really matters.
Tell me exactly what's happened. Well, my mother's just cut her leg. It's just been pumping out blood. How did that happen? She was putting socks on.
Okay, so he smoked a lot of marijuana, and now he's feeling crazy paranoid about his heart, and the heart rate is insane, and he's just freaking out.
Ambulance, tell me exactly what's happened.
We've got a little baby here. She was just breastfeeding and she's just gone blue.
Okay. Are you with her now?
Yeah, with her now.
How old is she?
15 weeks. But she was 10 weeks early, so she's 5 weeks adjusted.
Is she awake?
Kind of awake.
All right, well, I'm organising help for you now.
Jeff and Tamara are assigned to the case. They are 7 minutes from scene. A critical care paramedic is also attached. He's 8 minutes away.
161 with you.
Thanks, 161. I have you code 1.
From the PA area. I do have a CCP attached.
Claiming here is a 36-month-1 for a 4-month-old female, vaginal breathing.
Blue in colour. Code 1, thanks.
Oh, she's still blue. I guess just to get her management going, yeah.
Yeah, we'll get oxygen, get her on the bed and get her in the car. Patient was 10 weeks premi.
Yeah, it's pretty early.
Jesus, this baby's going to be tiny. They're obviously not getting enough oxygen to circulate to the rest of their body.
Going to a very unwell newborn is the scariest job that we will ever attend in our career. And if that newborn baby is premature, then there's even more potential for things to go wrong. Ultimately, if a baby's turning blue, it's a big indicator that they're struggling to breathe and they're not getting enough air.
We're after 133. So, this one with the gate that's shut. Yeah.
Makes you quite nervous before you even get to scene.
And we're after 131. That's 133. So, this one with the gate that's shut. Yeah.
Jeff and Tamara are attending a 4-month-old baby who was born prematurely. She's turning blue and struggling to breathe.
Hi, how's it going? My name's Tamara and this is Jeff. And what's our little one's name? Temperance. Hi. What was your name, sorry?
Giselle.
Giselle. Hi, Giselle. I'm Tamara. And is this little Temperance?
She's gone quite blue and limp as she's been having her pregnancy.
And there was some mention that this might have happened the other week as well.
It happened on Monday. She's been unwell just in herself as well. But it was definitely more sustained than the last time.
Now, did she completely go floppy, wasn't responding at all?
Yeah, like what I noticed is just she suddenly had this big pause in her breathing.
Okay, and how long did that last for?
Probably about 15, 30 seconds.
Okay. I'm just going to have a little listen to her breathing. Sweetie.
I think it would be extremely scary and terrifying for a parent to witness their child becoming floppy and turning blue. As a paramedic, it's also one of the last things that we want to see.
She is still quite a bit mottled and still quite pale. Are we able to try and get her out of all of this?
Really sorry, she's probably not.
No, that's okay, Giselle.
CCP Surge has been assigned to provide a further assessment of the baby's condition.
Yeah.
Hey, Surge, how's it going? This is lovely little Temperance. She has respirator 60, mild expiratory wheeze, no upper airway stridor at all on auscultation.
Whenever a baby is turning blue, they're struggling to breathe and they're not getting enough air. It can indicate potentially a respiratory or a heart condition. All of these things can lead to cardiac arrest.
She's okay at the moment. We'll take her up to the hospital and get them to check her over.
So a hospital is the best place for them to be able to diagnose the underlying cause.
The entrance to the world was scary enough. It's just, you just need to settle. You've done your drama, you've done your hospital stuff.
Give Mum a breather, hey, Temperance?
Goodness release. You spent 7 weeks there, you don't need to go back. It's just unnecessary.
Maybe she likes the staff, so.
For the second time this week, the baby will be admitted to the Queensland Children's Hospital 15 minutes away.
I'm not yet a mother myself, but I can empathise with new mothers. It's hard enough having a newborn at home, let alone having one that's struggling with medical conditions. So I really do feel for parents.
We'll just duck you back up to QCH then, hey? And see all of your other friends. Was this first baby?
No, but my first baby was.
Sorry to hear about that. So what made you pick Temperance?
I've loved that name for years.
Oh, well, that worked out well.
It did.
No.
Yeah. She needs a bit of calm in her life, and that's what the name means, so. Although you're not doing a great job of living up to your name right now, I'm telling you.
In this job, you're constantly reminded of the fragility of life. Newborn babies are so beautiful. There's so much life left yet to have. We need to be able to do everything that we possibly can to give them the best chance of survival.
While CJ and Eliza wrap up for the night, news has come in about their earlier motorcycle patient.
Hello. How is he? So he's gone to surgery.
Yeah.
Ruptured spleen. Ouch. Some rib fractures, a whole bunch of other stuff going on, but that's what they're focusing on at the minute.
I'm really worried about her. I'm doing she gets some medical assistance because one, that elbow
look atrocious.
And two, she was just in like a really bad motorbike accident. Like if he's that unwell, like there's that risk for her as well.
Yeah.
Unfortunately, as much as you want to help everyone,
not everyone wants the help.
Next time...
It has two dislocated hips, a dislocated shoulder and a dislocated jaw from convulsing during the seizure.
Common call, any units available, code 1.
A scooter collides with a van.
Were you wearing a helmet?
Got legs from that road.
And a toddler in pain.
Burns happen from a hot water system.